Hello guys, welcome back, and today we are going to see some of the very important thing which you have to keep it in your mind when you're working as a healthcare professional. Conflicts are common when you're working in a healthcare field. So identify the conflicts and find out a solution for your conflicts. That's your responsibility. So in this video, we are going to see some conflicts and how to overcome that conflict. So the topic is conflicts and dilemmas that may arise between individual rights and duty of care in health and social care setting. So conflicts, a clash in conversations, that is simply conflicts, right? So clash in opinion, that is simply called conflicts, right? So conflicts are common because we are dealing with intellectual and emotional aspect of patient. So I have my own opinion, you have your own opinion, and especially if you are a patient and I'm a healthcare professional, definitely you will see lot of conflicts because we are dealing with different kinds of feelings at a time. So, for example, when you're giving medication, there are chances of refusing the medications. Patient is bedridden, patient is admitted and hospitalized and admitted. Patient is in a stage to take medications 3 times a day, 2 times a day. So, in that kind of situation, definitely there are chances of refusing the medication. So, in that case, how you will manage the situation and how you will avoid developing conflicts. I'll give you some simple solutions to avoid that complex conflicts. So first thing is put the patient's interest first. So keep your patient in the center of care. So that is called person-centered care. So put your patient interest first. If you are trying or if you're ready to do this thing, definitely you can avoid 99% of the conflict. Second thing, consider each patient's rights. Guys, you are a human being, I'm a human being, we all are human being with different kind of rights. We have some rights, right? So consider each patient's rights. My rights are different from your patient's rights. So what you're supposed to do means understand the right. What is the right? Consider each patient's rights and go ahead. Then you can overcome 90% of the problem. Then give care by considering their likes and dislikes. Understand their likes as well as their dislikes. Understand their likes and dislikes. Then do an open discussion and explain the needs and importance. So always try to do an open discussion and explain the things to your patients. Okay, this is the situation, could you do that? This is the situation, would you do that? So explain and ask. Okay, so if you do an open discussion and explain the needs and the importance of the particular situations, definitely you can avoid 80 to 90% of the conflicts. Conflicts can arise because sometimes the patients are not aware that their behavior will cause danger or harm to themselves or others. So, in this situation, what you have to do, you have to understand your patient properly. For example, the patient with some kind of disabilities, I don't want to explain what kind of disability. Okay, in that stage, sometimes the patient will not understand this particular action will affect them and will give harm to them. So in that situation, what you have to do as a healthcare professional, it's your responsibility to understand that this kind of behavior will be harmful to my patient. So I have to take a necessary step to overcome this thing. So it's up to you guys, it's in your hand. If you are trying hard, definitely you will get the result and you can avoid conflicts and you can improve the quality of care. Then next thing is assess the severity of the condition. So before going to take a final decision or judgment, assess the severity of the condition. Okay, patient is refusing the medication for first time, just leave it and wait for the patient. Continuously the patient is doing means you can report the things to a manager or the respected responsible person. Okay, so assess the severity. So you have to use your common sense and you have to do a critical thinking. You must be a critical thinker. That's what when you do the interviews or when you are attending the interviews, there will be a question, definitely for sure. There will be a question, what is the meaning of critical thinking and how we will do critical thinking in practical way in this particular situation. So in words we will explain, I'll do that, I will do this, I can handle in this way, that way, like that. But when it comes to reality, most of them are getting scared and most of them are going back. So to avoid this problem, what you have to do, you have to assess the severity of the condition, take the decision based on the situation, understand the condition of the patient, assess the severity of the condition and take the decision and give opportunity to the patient to take decisions. that means what? Allow the patient to indulge or involve in decision making process. So that is very important. So if you are allowing them to allowing them to include in the decision making process, okay, definitely they will think that, okay, I have also a part, okay, I'm also a part, I have also a position, I have also a chance to talk about my situation. So then they will feel more secure, they will feel more confident, they will feel sometimes more lovable, they will more feel they will feel more safe. Okay, so in that stage what will happen, they will try to obey you. Okay, automatically that mind game you have to play to avoid conflicts and to improve the quality. Some people with learning disabilities are not in a stage to decision, and some people are in a stage to take a decision, but the decision will not be effective for them. In that stage, what you have to do, you have to tell the patient, I know that you like it. For example, the patient likes to eat chocolate, it is not good for him, but he is keep on eating or she's keep on eating. So in that stage, what you have to do, I know that you like chocolate, but if you eat and if you continue like this could be the end result. So you have to explain, but don't exaggerate the situation, don't create a threatening situation. If you eat like that, you are going to die, kind of things don't do an open discussion and in a friendly way discuss the thing. Okay, and then gradually what will happen, the patient will start to understand and will start to respond back. Okay, so in that, if you follow this thing, 90% of the conflicts you can avoid. I'll give you an example, then it will be easy for you to understand how to overcome conflicts. Giving medication to a paranoid schizophrenic patient. Okay, schizophrenia, you know what is schizophrenia? It is a condition characterized by, it is a psychiatric condition characterized by disturbances in the thinking, memory and behavior. So in that case, the patient sometimes will behave in a different way. So 100% they will refuse the medication if you give the medication. So what you have to do? You have to wait for your patient. That's it. That's the simple thing you can do. Wait for your patient. Okay. So sometime after some, what will happen? The patient will come back and they will be ready to take the medication. So wait for it. Give the medication. But if the patient is continuously doing that behavior, means definitely report to the manager or report to your nurse manager or the lead or respectable responsible person and take the necessary step to help or support your patient. Here you can see some simple solutions to overcome the problems. Effective communication, that's very important, guys. Effective communication, do effective communication with your patient. Effective communication is the fundamental thing which you have to hold in your hand always when you work as a healthcare professional. So effective communication. Then interpersonal communication. What is interpersonal communication? Communication between you and your patient. Maintain a warm, then maintain a good, and maintain a secure or comfort interpersonal communication with your patient. Then they will come to your track automatically. Then collaboration with other departments. You know that healthcare profession is a team profession, right? So we need to work as a team to provide quality care to your patients. So collaborate your work with your other departments and get the support and work. Then you can avoid conflicts. Then critical thinking, as I said. So based on the situation, you have to think. That's what I said. Assess the severity of the condition, severity of the present situation. Okay, this is too much. Okay, this is not. It's not going in a good way. Okay, I have to do something. Or okay, fine, we can wait for some more time to make the patient to get into the track. So critical thinking, it's very important. Then problem solving skill, don't go for anything, don't go directly to your manager or your nurse head for each and everything. Try to take a decision based on the situation by using your critical thinking ability. Okay, then be a good listener rather than a speaker. That's very important. Listen your patient first rather than talking. Listen. How much you can listen, that much you listen. Then do an open discussion. Then find out the solutions to overcome the. Okay, and here you can see some do and do not don't list. Okay, if you do like this, it will be good, and at the same time you don't do this kind of things. Okay, there are two columns you can see. So in do things, I just want to say these things like ensure safety and take reasonable steps, inform and take decisions, inform the family and relatives about the request and do follow for MCA, that means mental capacity assessment. If you think that your patient is not having the ability to take decision, seek for additional support and advice. Again, I want to repeat that. Ensure safety and take reasonable step. Ensure safety and reasonable step. Inform and take decision. Inform the family and relatives about risk. Request and do follow up for MCA, that is mental capacity assessment. In which situation, if you think that your patient is not having the ability to take a decision, seek for additional support and advice. Okay, then at the same time, you don't do some kind of things like don't say what they can and what they can't do. Don't say what they can do and what they can't do. Don't order, don't command, then don't get exaggerate while discussing. Don't worry about breaking confidentiality if you see an abuse, and don't assume your patient doesn't have the capacity to take it. So you don't assume that he or she is not having the capacity. So don't assume your patient doesn't have the capacity to take decisions. So keep this point in your mind, guys, then you can avoid conflict. And in conclusion, I would like to say that, however, the final choice of this decision making process is who? Patient. So, however, the final choice is theirs, the patient's or family. But we need to do our best by asking why they have made their decision. Explain the risks so they can rethink once. Follow their care plans. Complete a risk assessment. Help them to minimize the risk by continuous monitoring and support, and seeking support from your managers and their supporting team. So these are all steps you have to follow while working with your patient to avoid conflicts. If you follow the simple step, you can avoid 90% of the conflict, and there are legal aspects also to take the next step and all. So in next video we will discuss what is Equality Act, what is protected characteristic features, what is mental capacity act, and etc. Hope you understand, guys. Thank you.